Hello, everyone, and welcome to another episode of Fertility Docs Uncensored. This is Dr. Carrie Bedient at the Fertility Center of Las Vegas, joined by my intelligent, compassionate, ambitious, brilliant rock stars of co-hosts, Dr. Abby Eblen from Nashville Fertility Center
Hi, everybody.
and Dr. Susan Hudson from Texas Fertility Center.
Hey guys, how y'all doing?
Good.
Doing
How are you?
good.
What's
Doing good.
new?
I've been cleaning out my closet again.
On
How often
purpose?
do you do that, Susan? Seems like we've talked about this before. You're
I
too much of a cleaner, I think.
I
Make
probably
me feel
try to
bad.
work on my closet like a couple times a year.
Oh
What
man.
do you do?
If
Like, how
only.
does your closet need work a couple times a
Does
year?
it talk to you like, come on in, get rid of some clothes?
Yeah, essentially it's kind of like when I start running out of hangers or there's like some part that's gotten junky and I'm like, okay, I need to address that. And so it's not like I do a whole closet run through, but there's always improvements.
So I have questions for you. Number one, do you have those plastic white hangers or do you have the cloth covered hangers?
Actually, neither. I've discovered something I like even better. Okay, so I don't, so the plastic ones take up a lot of room. Okay,
Okay.
the wood ones are super expensive.
Yep.
Yeah.
And the ones with the felt fabricy stuff, I don't like it because like they pull on the shoulders of your shirt.
Yeah.
And, like they
Yeah.
annoy
Stretch
me
it.
when I try to hang things up. So they have there's these metal hangers, but they're thick and they're silver and they're
Hmm.
super smooth and they're super sturdy. And so I've started replacing all of my clothes hangers with those. And then I have some that are similar, but they are like a half. They look kind of like the number two. And
Uh-huh.
it has
They're for
a
pants.
little rubbery thing on the one part, and that part's for the pants. But I love these hangers because they don't take up a ton of room, but it's very visually appealing when you look at
Oh.
it, but you can
So,
get a lot of them in.
okay. So I have a question about the psychology of this, Susan, because my problem is I walk by my closet and it's like it's disorganized. I need to do something. I need to get rid of clothes. But I'm like, but I like that. And no, I might wear that again. And I've broken the 2-year rule many times over. Like things have been hanging in my closet over 2 years.
Oh
I'm
yeah.
like,
I
oh,
don't
I
necessarily
forgot
get
about
rid
that.
of things all the time. I just try to make it more organized. I mean, if I need to go through and, go through things, like I'm more likely to do that if I've gone to like a big shopping trip and I'm like, okay, I just got a whole bunch of stuff I really should go and filter
So are
out.
you like Marie Kondo? You like the things that make you feel good, the things that make you feel bad. I forgot what her.
No,
She's got three
it's
categories of stuff.
it's more making things look nice. It's
So
Hmm.
the
do you have a
perception of
color coded,
organization. Huh?
do you have a color coded closet? Like are all the red shirts next to the blue shirts next to the green shirts?
No, but
I
I
do.
have shirts, I have pants, I have tank tops, I have longer things. Um,
Mine's
like
color coded.
everything has like a place and it drives me up the wall when my husband goes and shoves everything in the same place, but then I can filter it all out and get it where it needs to be.
Hmm.
Abby,
Hmm.
did you say yours is color coded?
Yeah, I mean that sounds like obsessive compulsive, but it's really not. It's like sort of the greens and blues are together, and the pinks and reds are kind of together. Because it just, if I think of something, it helps me hone in better on where I need to look in my closet for it. Because otherwise, I'm like going, where did that go?
If I ever
So.
like redid the structure of my closet, I might be like an impetus to do that. I also have great boot hangers. There's these amazing boot hangers. So you don't have
Oh,
boots stacked all over the place. And they hang
yeah.
up and then they have like these long, it's about, I guess, a foot and a half. And then it has a little curve up and they're matched
Oh,
up. And I think you can hang 4 sets of boots.
oh
So
my
in
gosh.
about a probably 8-inch segment of your closet, you can have that. And then you just have all of your boots hung up. And
Where would
then
one buy these boot hangers if they wanted to?
Amazon, of course.
Okay. What are the name of these boot hangers? Just
I
boot
don't know, but
hangers?
I can get them for you.
All right. There you go. Hey, I didn't know those existed.
They're very cool. I gave him as Christmas presents this year.
I don't think I got one from you for
No,
Christmas,
I
but
got them
hey.
for my brother-in-law and sister-in-law.
I
I feel like living in the South, both of you are obligated to have these boot hangers.
didn't know they existed, or I would have already had them by
Oh,
now.
they're great.
Wow,
I actually don't
man.
even, well, I do have cowboy boots, but those aren't the boots on my boot hangers.
They
I actually
don't,
don't
those
have
don't get
cowboy
priority?
boots.
I don't wear my cowboy boots very often anymore. I had them mainly from years ago. These are more like dressy boots and stuff like that.
Yeah.
Or like my Birkenstock, winter boots or stuff like that.
Hmm.
Birkenstock winter boots.
They
Got it.
kind of
Never
look
seen
like
those.
Uggs, but to me they're more
Oh.
comfortable because it's like
Huh.
they're great. Oh my goodness. Like you can just wear them like wear your normal Birkenstocks and they keep your feet nice and warm.
Huh.
So,
Okay,
Carrie, you
so
haven't told us anything about your closet.
I mean, it's a closet. It's clean. There's light in there. I mean, it's organized
Okay.
generally. My husband is the more compulsive one. His stuff is somewhat color coded, which is how I knew to answer that question. Unlike his father, who has color coded hangers and
Oh, wow. I don't
color
have that.
coded like organization. I think I've heard rumors of this. I have not actually seen it. Because yeah, dealing with one man's closet is quite enough. Thank you very much. But yeah, no, I mean, yeah, I've got a closet. There are clothes in there. I wear them.
When you don't ship them back to Amazon or back
When
to
I don't,
this
yeah, when I don't ship them back because they don't fit.
previous
But
episode.
yes. All right. So now that we have been the fertility clothing docs uncensored, we'll go back to our regularly scheduled episode.
With a question.
With a question. And what question do we have today? Or questions?
Okay, so hi, my husband and I are starting to plan our future family. I'm having my IUD removed next month, and I just listened to your latest fertility myths episode and wanted to ask about one that I've heard a few times. Is peeing right after sex going to hurt your chances of successful fertilization? I'm not sure if the logic is because ejaculate may leak out or if there's some other reason behind it. I'm curious.
So most times the reason that people say go pee after sex is to minimize your chance of urinary tract infections, because with the action of sex, it can push bacteria further up your urethra, so the little hole or the tube that pee comes out of, and that bacteria is not designed to be up there. And so who wants a UTI? And so that's part of the rationale of why people say pee after sex. It's got nothing to do, good, bad, or otherwise, with implantation. And the sperm is designed to come out, in the sense that the ejaculate goes up to the top part of the vagina. It hangs out outside of the cervix, but it doesn't go any further. It's not supposed to go any further. So it's not like the ejaculate goes up into your uterus. It's that the fluid sits at the opening to the cervix, the sperm then swims through, and that ejaculate's going to come out one way or the other, whether it's 5 minutes after sex or the next morning or
So
whatever.
essentially the liquid part comes out.
Yeah.
Yeah. And so
the sperm that swim up super, super fast.
Yeah.
So, I mean, it's your timing of when you pee really has not a lot of bearing.
it's true.
It's not a birth control method.
Absolutely not.
No, do not rely on this. All right. So today we are going to talk about something that all of us do day in and day out, and we recommend 85 million times a day, which is ultrasounds. And so what we're going to do is we're going to go through everything about ultrasounds and what they are and how they work and all of those things. So first of all, let's talk a little bit about the technology of it. What is an ultrasound? Compared to maybe some of the other things that people have heard about, like CTs and MRIs and that kind of thing, X-rays. Like what is an ultrasound?
It's basically just sound waves that go through your body and we can see things. And depending on how we do the ultrasound, sometimes if we do them a certain way, we can see your female organs a lot better. So most people are really familiar with abdominal ultrasounds, and those are more commonly done like after a woman gets pregnant. We can look at the baby a little bit more easily with that as the baby grows, and particularly as the baby gets bigger. That's really the only way we can see the baby. When it's smaller, sometimes we can see it abdominally, but typically for what we do for people who are not pregnant or really early pregnant, the best way to get the sound waves really close to the uterus where the baby is or where your ovaries are is to look vaginally. And that sounds for a lot of people, when I say that, sometimes people are like, "What do you mean you're looking vaginally?" And we literally take a probe. It's round. I mean, it's kind of like not a lot bigger than a penis. I mean, it's basically kind of like that, and only a small portion of it goes in you and just goes right up against your cervix. And so we're able to get a much better picture of the uterus and of the ovaries, of the soft tissues when we do the ultrasound. And there's some more advanced ultrasounds where we can actually put fluid up inside the cavity and get a better view of kind of like almost like blowing air into a balloon. We can get a view of polyps or things that may be growing in your cavity that we can't even see with just a basic vaginal ultrasound.
So what's the value of an ultrasound compared to a CT or an MRI? So first of all, what's the 2-second description of a CT or an MRI and what they can show?
Well, CTs or MRIs are essentially taking slice pictures of you in one direction or the other. And you're either using forms of radiation or magnetic technology to obtain those images, which, like Abby said, ultrasound, we're using sound waves. So with sound waves, we aren't going to create any damage to you. So it's very safe to do. It's very safe to do even if you might be pregnant. I often have people come in who are like, "Oh no, I'm in the second part of my cycle. What if I'm pregnant?" It's like, it's safe. It's good.
Fun.
It's good. And it's very accessible, which is the other part of it that makes it so super important to us. I mean, CT machines and MRI machines are gigantic. You have to have special facilities. They're super duper expensive.
Expensive, yeah.
Whereas ultrasounds are available all over the world. I mean, we have big machines, we have little bitty machines, we have all kinds of
Mhm.
machines. And with different types of programming, those ultrasound machines can look at different parts of the body in different ways. So if you're getting an ultrasound done like at a hospital, they'll often have many, many profiles depending if they're looking at a human heart or your abdomen or your pelvic organs or looking for vessels, all those different things. We in our offices have it set up for looking at pelvic organs and first trimester pregnancies. And so we're able to, in a very efficient manner, have you in our office get real time imaging where we can take a full look of what does your uterus look like? What do your ovaries look like? Is there anything in those regions that make us concerned? And there's lots of things that we're going to look at, which I know we're gonna get to. But in a matter of 15 minutes, we can know so much about you that has been hidden until that moment.
Mhm.
So when you talk about accessibility, CTs and MRIs are crazy expensive, big, awkward, all of those things. So
Takes a
not
long time
accessible.
to get people in for those too sometimes, get
Yeah.
scheduled.
What about x-rays? Why can't we just get it with x-rays? Because that's even faster than an ultrasound and it's even cheaper in some respects. So why don't we just use an x-ray?
X-rays
'Cause
really
some
look at bones and hard
Yeah,
tissues, whereas we're looking at soft
soft
tissues,
tissues.
squishy things.
Yeah. It doesn't look at mushy things.
Okay. So now that we've decided that ultrasounds are pretty much the best thing since sliced bread, when you are looking at an ultrasound and you put that probe in, whether it's a vaginal probe or an abdominal probe, and you look at the screen, first question that's important to know for everybody is it going to hurt?
No.
What about the vaginal part of it where you're sticking bits, you're sticking a wand, which I mean, this is not Harry Potter. This is not Harry Potter goes X-rated. It's not that kind of wand. But how does that feel?
So if you have vaginal intercourse or you use like a super tampon, you will probably be fine. Okay. So the way this works, so the wand for our listeners, not our viewers on YouTube, but for our listeners, the wand is probably about 18 inches long. That does not all go in you. Okay.
Mm-mm.
So we have the wand, we have the part we hold. So that's taking up part of the wand. And then the other part of the wand, we put some gel on the tip and we put a long condom, literally, over it. Okay. And if you have a latex allergy, we have special condoms for that. And then we put gel on top. And then what we have you do is we'll have you lay on the exam table, put your legs in the stirrups, just like when you're getting your pap smear done. Let you relax your legs out to the side. Now, I can say if you squeeze your pelvic muscles all together, it's going to be more uncomfortable than if you can take a few deep breaths, kind of let your back sink into the exam table, and we gently insert the transducer. That's what the wand's called, the transducer into the vagina for us to be able to see your pelvic organs.
So, what are our favorite organs to look at with an ultrasound? And
We
what do
love
our ultrasounds tend to see really pretty well?
we love to look at the uterus. So we look at the smooth muscle of the uterus, and we're looking for things that shouldn't be growing there, things like fibroids. Um, we also sometimes can see a condition called adenomyosis, which is grows in the wall of the uterus, or at least have a suspicion that that's what you have. If we put fluid in there and open that up, so sometimes we'll actually put saline in there and it has to be timed with your cycle, and it has to be at a particular time in your cycle. And we know you're not pregnant, but it's like blowing air into a balloon, as I was saying earlier. It opens the cavity up, and we can see if there's things like little polyps, which are kind of like little peas kind of size things growing inside your cavity. Sometimes they can be bigger than that, but that's more typical. Sometimes they can be kind of like skin tags, polyps, or fibroids. Sometimes fibroids can be even bigger. Sometimes they can even fill the cavity, or fill the wall of the uterus. We also look at the ovaries, and we look at structures that contain fluids. So cyst, and you have a benign cyst hopefully every month if you ovulate every month, because that's what you grow your egg in. But there's certain types of cysts that are not benign, and are ones that at least are not ones that we want to see in there, even though they're not, actually cancer or malignancy or anything. So those are primarily things that we look at when we do an ultrasound.
We also, on your ovaries, will do an antral follicle count. And that's where we're looking at the little bitty follicles, the houses of the eggs, and we're counting them to get an idea of egg quantity. Ovarian reserve testing is not perfect, so we do multiple things to look at your ovaries, and this is one of them. And this is actually one of the biggest reasons why, if you've had an ultrasound done somewhere else, we're going to want to do an ultrasound as well, because unless you go to a reproductive endocrinologist, most people haven't done an antral follicle count on you.
Yeah, and one good point about that, I'm glad you mentioned that, Susan, because that's one of those tests when we do it, and this happened to me just last week. I was seeing a patient, and she was young and she had irregular cycles. And I thought, oh, I fell into the trap, which I was like, oh, I'm sure she's got polycystic ovary syndrome, meaning her brain's just not communicating with her ovary. But I assumed based on her age, she had a bunch of eggs. Then we did the ultrasound on her, and it really told a very different story. She had a really low egg count. And so when we actually did a more definitive test, an AMH, to look at that, that's in fact what it was. She had a really low egg count, and that's why her cycles were getting so irregular, because she didn't have many eggs. And that was something that on the spot, when I saw that, I'm like, oh, I'm somewhat surprised about this. We'll check it out and see what's going on. But it kind of at least gave me the ability to talk to her, even in that initial visit, about, maybe this is why you're not having regular cycles. So it can be really helpful on the spot.
Mm-hmm.
So when we talk about timing things, because of course timing is everything, especially in our world, and we say, okay, please come in on day 3 to get an antral follicle count, the first thing that our patients say is, but I'm going to be on my period. I'm going to be bleeding. Do we
We do.
care?
We do ultrasounds no matter when it is in your cycle. It really doesn't bother us if you're bleeding. If you let us know you're bleeding, that's great. We can put down some things on the table so that it'll be more comfortable for you and that type of thing. But from our perspective, this is what we do, and it really doesn't matter.
Doesn't bother us at all. We're
Mhm.
not grossed out about it at all, or we wouldn't have gone into this field.
Also, it's really not going to feel a whole heck of a lot different for you either. If anything, there's more lubrication because there's the menstrual fluid that's coming out. And so it doesn't hurt. I mean, if you're having really heavy cramping, then it's probably not going to feel great, but it's also probably not going to change the cramping that you're
Mm-mm.
feeling, making it better or worse. It's just there. Um, so when we're looking at ultrasounds more than once, we've had people kind of look at us, and if you imagine your grandma or your great grandma's TV that's sitting in the basement in the corner where you got that like 12 to 18-inch screen, and it's just shades of gray, and it looks like a really staticky TV. How can we look at that and see anything? Because that's what many people say, what the hell are you looking at? This is just black and gray fuzz. So when we're looking at that, what kind of things are we seeing? What are we looking for?
So I'll back that up. And I just like to share the story that this is learning how to ultrasound ovaries, especially, is something I distinctly remember learning
It's
in
hard.
residency because it's hard. It's hard. And I remember asking for help and wanting to make sure I was seeing all the right things. And I was just like, my upper level finally was like, "You're the only person who's asking. Are you just not finding him?" I'm like, "No, they're just not telling
You're
me."
being honest.
Exactly. I was like so blatantly honest because I was so worried about not finding something that was important. And so, it is something that we do literally from day one of residency, and we're learning how to do this. And we spend decades looking at shades of gray, and we learn what a normal uterus looks like. We learn all the different phases of the uterine lining. We learn what the ovary is supposed to look like. What are things that make us worried? What are things that I would call a benign variant? So not something that's cancerous, something that may cause you some problems, but it's a variant, and it's something for us to be aware of.
And one really important point I would like to make about that is it's dependent upon the ultrasonographer. So Susan made a comment that our ultrasonographers and we do lots and lots and lots of GYN scans, and it does take years of practice. It is not something somebody can just walk into the office and learn at the end of the week and be done with it. It takes years and years of practice, and I still feel like I'm learning things when I do ultrasound. And so if somebody goes to an emergency room somewhere out in the middle of nowhere and has an ultrasound to look, say, for like a tubal pregnancy, I've had people go, well, they didn't see anything on ultrasound. Well, just because they didn't see it didn't mean it wasn't there. Maybe it was too small, or maybe they're just not really experienced in looking for ectopic pregnancies, which I think is one of the harder things to do with ultrasound. And so it really depends on the ultrasonographer. So that's another reason why a lot of times we like to do our own scans, because it is amazing the things that we can pick up on ultrasound that maybe if you had it done by somebody that doesn't do routine GYN scans may not pick up on the same thing that we would pick up on or look for the same things we're looking for.
So why do we get so hung up on vaginal ultrasounds? Because many a patient will say, why do you have to put a thing up my lady bits, and why can't you just do it on top? And why?
Because we get the best images through a vaginal ultrasound, because a lot of it has to do with distance. And the closer we can get to the actual organ of choice, it just, we get better images. And, we're, especially if you're going through like an IVF cycle, we're sometimes measuring many, many, many follicles. And we're talking about things that are less than a centimeter when we start off with. And having to go from one end of that ovary to the other end and maybe make 20 measurements in that one ovary. It's a lot, and it's what's going to give us the best idea to guide your care during your fertility journey.
Let me just pause here for 1 second and say, Carrie, every time you say lady bits, it just makes me want to crack up. I don't know what it is about lady bits, but you just throw that out periodically. I haven't heard lady bits in a while, so it just made me want to break out in laughter.
Just want to keep things fresh, and
I like it.
there's,
I like it.
there's so many uncomplimentary phrases for that part of a woman's body. Like, I think lady bits is just,
I like it. I like it.
yeah. Nobody ever gets offended if you call them a lady bit.
We study lady bits. That's
Yes. Although I don't think I've ever called anyone a lady bit, but now that I've thought about it,
right.
I will consider that when the time is right. So can you see everything with a vaginal ultrasound? Like, can you
No,
see
you
that
can't.
embryo go in? Can you see a pregnancy 2 days
No.
after a transfer's occurred?
So size matters like everything. And so when we put the little embryo in, a lot
Abby,
of
I'm
times
so proud of you for saying that. I
know,
just,
you're rubbing off on me, Carrie. I'm starting to get a little bit more uncensored.
I will take it. Anyway, excuse me. I did not mean to
Anyway,
size
so when we
that.
do an embryo transfer, we literally cannot see that little embryo with like somewhere between 150 to 200 cells. A lot of times we'll put a little air bubble in front of that, and air bubbles can be picked up on ultrasound. So when we push that little plunger, we know that when something comes out, if we see the air bubble come out, the embryo should be right behind it. And of course, if we're doing a transfer like that, we double check. We have the embryologist look at the catheter, but we can see air. The things that we can't see very well, we can't see your uterus very well. If your bladder is not full, your bladder tends to push everything to the side. So when it gets full of liquid, it pushes your GI tract, your bowel off to the side. And our sound waves will go through your bladder because it's full of liquid. So liquid and sound waves agree with each other, and it'll go right to your uterus, and we'll be able to see your uterus. But if your bladder is not full,
And
then a lot of times.
Abby's talking about an abdominal ultrasound right now.
Yeah, sorry. Yeah, I am talking about abdominal ultrasound. So we want your bladder full if we're doing that. If we're doing vaginal ultrasound, just in general though, if there's bowel in the way, a lot of times, if we see first thing in the morning, your bowel's percolating around. Sometimes we have difficulty seeing things like your ovaries, for example, if your bowel's percolating. And sometimes if it's really important to look at both ovaries, sometimes we'll even have patients like come out of the ultrasound room, wait a little bit, and we'll look again to see if we can see those. But the answer is really small things we can't see, and things that are blocked by the bowel we can't see very well. And really small things, like if you have a pregnancy in your tube, sometimes we can't see that.
So other things that we usually don't see, number one, we usually do not see fallopian tubes. If we can see a fallopian tube on an
That's a
ultrasound,
problem.
it is abnormal. Okay. So sometimes people are like, they didn't see my fallopian tube. And I'm like, that's a good thing. Because if we saw it, that
Yeah.
would actually be a bad thing. So that's one thing. And with the exception of an endometrioma, a collection of endometriosis within a cyst in your ovary, we usually cannot see endometriosis. So that's a big one because people are like, did you see the endometriosis? And it's like,
Yeah.
well, your ovaries look good. I generally should not be able to see anything that looks like endometriosis elsewhere. That's another big one.
Can you pick up endometritis on an ultrasound?
No, that's because that's
no.
inflammation and that's something that has to be diagnosed under a microscope. So we have to get a little sample of the lining of the uterus one way or the other to evaluate that.
Mhm. When are other times that using ultrasounds can be particularly helpful? So when it's not the primary thing, but it's a secondary thing. So particularly during,
Ovulation.
surgeries.
Oh, I thought you meant ovulation. So a lot of times we'll bring people in for ultrasounds to look and see. We can't see the egg, because the egg is microscopic, but we can see the fluid-filled sac around the egg. And when we look at the size of that fluid-filled sac, we can make a prediction about whether or not we think that egg is mature. So sometimes we use ultrasounds for monitoring, so not necessarily to diagnose a problem, but to monitor your ovary and see if it's the time's right that, for example, you're ready to do an intrauterine insemination. So if we see a fluid-filled sac that has a mature egg, most of us would give a shot to trigger ovulation, and then we would time when we would do the IUI procedure, the intrauterine insemination procedure in the office based on that.
So sometimes I think what Carrie was also alluding to is sometimes we use ultrasound at the same time as surgery. There's a couple of types of surgery I think of. So if you have cervical stenosis, so if your cervix is super, super tight and we have trouble negotiating the little catheter in the office, and we have our normal tricks on how to dilate your cervix in the operating room, but sometimes it can be even more challenging, and having an ultrasound at that time to make sure our little dilators, the little sticks we are using to open up your cervix, can help us do that. Also, if we're doing certain types of surgery in the uterus, like if we're resecting a septum, or even sometimes if you have a miscarriage and we're trying to make sure we're getting all of the miscarriage out of the uterus, ultrasound will be used at the same time.
And a couple of other things, like if you have scar tissue in the cavity, sometimes if the cavity has a lot of scar tissue, it's almost like somebody's put super glue in the cavity. Sometimes it's really hard to figure out kind of where the cavity is and to open it up. So that can be helpful. Most recently, I used it to really try and get a fibroid out of the cavity. So a patient had a fibroid that was about 3/4 of the way in the uterine wall and only a small portion was pushing into the cavity, and I needed to make sure I could get all of it. It helped guide me to kind of dig that fibroid out since it was kind of buried in the wall of the uterus.
One of the things that we use ultrasounds for, if you think about surgeries, one of the biggest risks of surgeries, especially what we do, is perforation of the uterus, where you're going through and through a wall that you really shouldn't be going through. And while the uterus tolerates that really pretty well, there is the potential for bigger damage when you do that. If you're using an ultrasound, it means that you know when to stop. when you otherwise wouldn't necessarily know when to stop. And so that's why when we talk about doing D&Cs, a lot of us will automatically do it under ultrasound guidance, because it means that we can spend the absolute minimum time in the uterus in the safest way possible, so that the risks of scar tissue forming and all of that later are much more minimal, and any other damage is much more minimal, because we're doing what we have to do and no more. And we really have a greater ability to do that, because REIs in particular live and die by ultrasound. All of us are very good at doing it. Our staff members are very good at doing it. And it takes very little to get one when we need one, to make a procedure even safer, whether that's in, an operating room or in our office or wherever. How do we get the information we want for IVF cycles? Why do we use ultrasound for that?
Well, like I was saying before, you can monitor follicles. So if you're doing IVF, you have multiple follicles, and we're trying to really, ideally, we'd like for all of them to grow kind of at the same rate. But just overall, we want to measure and kind of know when the time is right for you to actually be triggered, so that we can go in and retrieve eggs that are mature. So we don't want them to be undergrown. We don't particularly want them to be overgrown, but we're hoping that the majority of them can be a certain size, and it helps with the timing of when we're going to do your egg retrieval.
All right. So what other stuff, is there anything we're missing about ultrasounds? Questions that you guys get all the time that we need to make sure that we answer?
I would say one thing is, especially if you are going to a clinic that has ultrasonographers, there's always a chance that your doctor may want to see you in person. If there's something that just doesn't match or doesn't make sense, or, we work on our spidey sense a lot. And so if something just doesn't seem to add up quite the way that it should, sometimes we may say, "Hey, I know you were already here, but I really want to see you." And this is a rare
Hmm.
occurrence, but if your doctor asks you to do it, that's the time to really say yes. We
Yeah,
know
that's
it's
actually.
inconvenient. We know it's inconvenient. And so we would not be asking you otherwise, but sometimes we just have to see something in our own eyes. And having still images, although they are very, very valuable, they are not the same as going through the uterus and ovaries ourselves. So just kind of keep that in mind in case you're ever recalled and asked to come back for another scan.
Yeah, and actually,
Also,
too. Go ahead,
I
Carrie.
was going to say also, that doesn't mean that we don't trust our
Oh,
ultrasonographers.
no,
Like,
no,
if
no.
you get that same ultrasonographer again, you need to worry, because, oh my gosh, she didn't know, and the doc needed to see me.
Yeah.
It usually, our ultrasonographers are an extension of our own eyes, and we trust them really quite a lot. And so it just means that somebody picked up something where they're like, and oftentimes it's the ultrasonographer going, "This doesn't look right. I don't know why it doesn't look right, but it doesn't look right, and you need to look at this." And so it's not saying anything bad about our sonographers.
Exactly.
And sometimes too, if I have a really tough transfer, like if somebody doesn't get pregnant, sometimes I'm like, practice makes perfect. Why don't you come in and just let me measure the depth of your cavity again? Just make sure that we don't need to tweak anything or change the depth, and so just, I think the more we can have hands on and see things, particularly if they're unusual or there's something different, it's really helpful, and may improve your care, I think, if we are able to do those.
Hmm. And some of the technology that's come out, like the computer programs. I mean, there's a lot of four-letter words you can use to describe electronic medical records. However, one of the benefits is that it gives us a lot more of these images directly. So instead, where we used to have to print out a bunch of pictures and just flip through them, now, I can, with a couple clicks of a button, I can see an
Yeah.
entire video of what my
Mhm.
sonographers saw.
Mhm.
So it makes it a lot easier to see things without having to call you back.
Mhm.
So, all right, perfect. Anything else we need to touch on with ultrasounds and how amazeballs they are?
I think
No,
that's it.
they're
All
pretty
right,
cool.
perfect. Excellent. Well, we hope this makes your next visit to get your vaginal ultrasounds better. To our audience, thank you so much for listening. Be sure to tune in next week for more. Be sure to subscribe, leave us a review in Apple Podcasts, Spotify, all those places. We love to hear from you. We're on Instagram, YouTube, Facebook, so hop on by and leave us a like or a follow or a hello.
And you can also visit us on fertility.suncensored.com. We'd love to hear your questions and your comments. All questions will be answered on our podcast anonymously for our Ask the Doc segment, so don't hold back.
As always, this podcast is intended for entertainment and is not a substitute for medical advice from your own physician. All right, we'll talk to you soon.
Bye.
Bye.